Let me tell you about something that happened to a patient of mine named Robert. Robert was 6'2". He was healthy, or so he thought. For 3 nights in a row, he woke up at exactly 3:15 a.m. Not because he had to use the bathroom, not because of a nightmare, just wide awake. He told his
Margaret,
wife,
I can't seem to catch my breath.
I feel like something is sitting
It's
on my
radiating
chest,
down my arm.
but it goes away when I sit up.
He ignored it. Because it went away.
It went away. 10 days later, Robert had a widowmaker heart attack in his driveway. He survived barely. His cardiologist told him he had less than 5 minutes left when paramedics arrived.
This video is about the one thing Robert ignored.
Waking up at the same time every night for especially between
could be the
2
most
a.m. and
important
4 a.m.
warning your body
could be
ever
the most
sends.
important warning your body ever sends. I am Dr. Michael Hayes. Before we go any further, Patro, a brief note. Everything in this video is for educational purposes only. I am not your personal physician. These signs do not diagnose a heart attack. They are signals to take seriously and discuss with your own doctor. If you are experiencing chest pain, shortness of breath, or sudden dizziness right now, stop this video. Call 911 immediately. Today, I'm going to show you 7 specific warning signs your body sends sometimes days, sometimes weeks before a heart attack. Before we get to the signs, I need you to understand something critical about your body's overnight rhythm. Your body has a natural biological clock. It is called the circadian rhythm. Between 2 a.m. and 4 a.m., your body undergoes several changes. Your blood pressure naturally surges. Your cortisol levels peak. Your blood becomes more prone to clotting.
For most people, this is completely normal.
For someone with narrowed arteries, it is a window of vulnerability. Think of your heart arteries like water pipes under your sink.
Think of your heart arteries like water pipes under your sink.
When they are clean and open, water flows through easily. But
Water
when
flows
they are
through
partially
easily.
blocked, but the pressure builds behind the blockage. Eventually, something has to give. This is what creates those 3 a.m. wake-ups. Your heart is struggling. Your brain is noticing. This is your brain saying, wake up. Something is wrong. I need you to sit up and breathe. Let me tell you about one patient, David. David was 67.
Let me
He
tell
had
you
high
about
blood
something
pressure,
that happened to a patient of
nothing
mine
he
named
thought was
Robert.
serious. He was on medication. For 3 weeks, he noticed his sleep was broken. He would wake up gasping, sit up, catch his breath, fall asleep again. He assumed it was heartburn. He bought antacids. They did nothing. David came to the emergency room after his wife insisted. His ECG showed clear evidence of a heart attack. Warning sign number 1. Unusual fatigue. Not the tiredness after a long day. Something different. Tasks that were effortless 3 weeks ago, climbing stairs, carrying groceries, suddenly require real effort. A large study of women who later had confirmed heart attacks found that 70% reported this kind of fatigue. Here is the distinction that matters. Normal tiredness has a cause: a long day, poor sleep. Cardiac fatigue appears without a clear reason, and it does not fully recover with rest.
But these symptoms have been getting worse lately, doctor. I'm really quite worried.
I understand your concern, but we have a clear...
That deserves a conversation with your doctor. Warning sign number 2. Sleep disturbance. Difficulty falling asleep when you never had that problem before. Waking at 2 or 3 a.m. for no clear reason. Feeling anxious or restless during the night. A review of studies found that nearly half of all women, of 48%, reported sleep disturbances weeks before their heart attack. When the heart is under stress, the nervous system keeps you in low-level alertness, even during sleep. Your body is trying to stay awake because something is wrong. It is sleeping with one eye open.
The key signal to notice: sleep that was previously normal is now disturbed. This is new. It has no explanation.
Warning sign number 3. There are often subtle cues that you might miss. Persistent indigestion, a burning feeling in the upper abdomen, a PAL, unrelated to what you ate. Upper abdominal discomfort that you reach for antacids to treat. Here is why this happens. The heart and the stomach share nerve pathways. When the heart is stressed, it sends distress signals. The brain reads them as coming from the stomach. This is called referred pain. The distress is real. The origin is misidentified. If you are 60 or older and you are reaching for antacids more than usual pass, that conversation with your doctor matters. Warning sign number 4, a dull ache in the jaw. Neck discomfort that feels like a strained muscle, except you do not remember straining anything. Tightness in the left shoulder or upper back. The kind that makes you think, I slept wrong. This is how the heart talks to the body through shared nerves in your spine. The heart and the jaw share nerve pathways. When the heart sends a signal, the brain can misinterpret it. This is why someone can go to a dentist for jaw pain, find nothing wrong too, and later discover it was coming from their heart. If you experience unexplained jaw, neck, or left shoulder discomfort, especially with physical effort, please discuss this with your doctor soon.
Warning sign number 5.
A subtle, intermittent discomfort in the chest that does not feel like pain. Not sharp, not stabbing, more like pressure, a squeezing, a heaviness. People describe it as like someone sitting on my chest, like a band tightening. Then it eases, and you think, that was strange. Maybe anxiety. Maybe I slept wrong. Here is what was actually happening. That narrowed artery reduced blood flow to the heart. You felt it as pressure. Any episode of chest pressure that lasts more than a few minutes pero, even if it passes pero, deserves a call to your doctor. Warning sign number 6, shortness of breath that is new, that appears during activities that never winded you before. Or PREB, and this is the sign most connected to sleep, PREB, shortness of breath that wakes you up at night. Here is what it feels like. You have been asleep for a few hours. You wake up suddenly. You are short of breath. You feel the need to sit up. Within minutes too, after sitting up, the breathing eases. When you lie flat, fluid shifts in your body. A heart working poorly struggles to handle it. Fluid can leak into the lungs. The brain senses low oxygen and wakes you up urgently. Any new shortness of breath that wakes you from sleep, especially if you feel better sitting up, needs medical evaluation. Warning sign number 7. I saved this one for last, because it is the most overlooked. A sudden, unexplained feeling of anxiety. A vague but persistent sense that something is wrong. A feeling of dread that is out of character for you to mourn and has no clear cause. In emergency medicine, there is a term, impending doom. It is an actual medical sign. When a patient reports it, BPOW, even without chest pain BPOW, it flags immediately as a potential cardiac event. In women specifically, anxiety as a warning sign was reported in 35% of cases. This is not everyday stress or worry. This is an anxiety that feels physical. David's wife told me, he kept checking the door locks at night. He could not settle. He said, I just feel wrong. 3 days later, he had a cardiac event. He survived. He told me, Doctor, I knew something was wrong. My body knew. I just didn't know what to do with that feeling. This video exists so that the next person in David's situation knows exactly what to do. We have covered all 7 signs. But there is one more critical section, because knowing the signs is only half of what saves your life. The other half is knowing exactly what to do.
First, Graham, let me tell you who is most at risk for these silent warning signs.
People over the age of 55. People with type 2 diabetes are freeing, especially if blood sugar is poorly controlled. People with high blood pressure. people who smoke or have a family history of early heart disease. Women are also at higher risk for atypical symptoms. They experience jaw pain, nausea, and fatigue more often than men. The good news? Modern medicine has powerful tools to catch this early. There are 3 specific tests I want you to ask your doctor about by name.
One pumping, arresting ECG. This records the electrical activity of your heart.
It can detect patterns of prior damage. It takes about 5 minutes and is painless. 2 Gran, a cardiac troponin blood test. This detects proteins released when heart muscle is damaged. 3 Thraum, a stress echocardiogram. This shows how your heart performs under exertion. If you are over 50
and have not had these 3 tests in the past year or more, they are worth requesting at your next appointment.
These are blood tests and non-invasive scans. Highly informative. And they could save your life. Step 1. If any of these signs appear and they are new for you, do not dismiss them. Do not wait a week to see if they go away. Call your doctor within 1 to 3 days. Tell your doctor which symptom you experienced. Be specific about when it happened and how long it lasted. Step 2. If you experience active symptoms right now, chest pressure, shortness of breath, jaw pain, PEF, do not drive yourself. Call 911. Emergency services can begin assessment in the ambulance. They can perform an ECG on the way. Time is heart muscle. Every minute without treatment, heart cells are dying. Step 3, the aspirin question. Many people have been told, if you think you are having a heart attack, chew an aspirin. Here is the nuance that matters. There are 2 types of heart attack: blocked, BUN, or bleeding. Aspirin helps blockages. Aspirin makes bleeding worse. Only a hospital can tell which type you are having.
I'm calling because I need professional help.
Let the medical team assess. Do not self-administer medications. Step 4, note the exact time symptoms began. This determines which treatments are available. Step 5, stay calm. Sit in a comfortable position. Do not exert yourself. Wait for emergency services. For the person simply being informed of not in an active emergency fund, the 3 tests I described are your most powerful tools. With coronary artery disease caught early, modern medicine can do a great deal. Medications stabilize plaque. Lifestyle changes genuinely slow progression. Prevention is not about fear. It is about information. And information is what gives you the power to act. Let me leave you with Margaret.
After her ECG revealed damage, Margaret described those 3 weeks POV: unusual tiredness, disturbed sleep, evening indigestion.
Her cardiologist told her, every one of those was a signal. Your heart was trying to tell you. Margaret said to me, I had all 7 signs. I thought I was just getting old. That is why this video exists. You now have the list. You have the signs. You have the science behind them. Use it. I will wait. Here is what I want you to do before you leave. Right now, pause. Think of one person in your life, a parent, a sibling, a friend, who is over 50 and has any cardiac risk factor. Send them this video. You do not need to say anything heavy. Just, I watched something useful. Thought of you. That message could be the most important one you send this year. If this video gave you something valuable, please hit that like button. And if you want more medically accurate health information for adults over 50, subscribe to the channel. We cover the topics your doctor's appointment doesn't have time for. Remember, your heart often whispers before it screams. Listen to the whispers. I will see you in the next one.